health services.
When we have outreach, our immunization
treatment or the cure date is very low.
it spikes, it goes up.
All the knowledge and all the tools to eradicate it, and yet it is still prevalent in PNG.
People of all ages can get tetanus. It is particularly common and serious in newborn babies and their mothers when the mother is unprotected from tetanus. In Papua New Guinea, all provinces are above the risk category, and this is a very serious threat to all females between the ages of 15 to 44. The National Department of Health and the National Capital District Provincial Health Authority has officially launched the Maternal and Neonatal Tetanus Elimination campaign in NCD and PNG in collaboration with the WHO PNG and UNICEF. The primary focus of the tetanus vaccination rollout is to protect mothers and newborns in the country. Despite being labeled as a deadly disease, it is also curable through vaccination.
Maternal and neonatal tetanus is a tragedy that has no place in the 21st century because we have the solutions to eliminate tetanus. It is a disease that is entirely preventable, and yet it continues to steal lives of the vulnerable newborns and mothers, and particularly in areas where access to essential health services remains a critical challenge. I believe that this launch is a call to collective action, and it also signifies the determination of the PHAs, the National Department of Health, our development partners, and all stakeholders who are involved in ending this disease. And it's also a disease for which we possess all the knowledge and all the tools to eradicate, and yet it is still prevalent in PNG. We have a dedicated immunization team at NCDPHA, and they're stationed across 22 health facilities, providing critical vaccine services, including that of tetanus. We have increased our efforts under the leadership of Dr. Lano at NCDPHA, the Director of Public Health. We have increased our efforts aimed at expanding immunization coverage and antenatal care through our EPI and MCH programs, and we have achieved positive results. At NCDPHA, we believe that primary health care is the foundation to deliver effective, efficient health care to our people, and also to provide a care that is equitable, where everybody can access regardless of their socioeconomic status and other differences. Our clinics have good relationships with the surrounding community leaders and communities, which we build on to engage them in campaigns such as this. So these existing platforms will serve as a crucial backbone for our MNTE strategy here in NCD. Our doors are always open at NCDPHA. We welcome all our partners, because without partnership we cannot achieve our goals. The partnership is a crucial pillar that is required so that we can achieve the goals laid out in the National Health Plan. So with our partners, we can ensure access to clean deliveries, support skilled bed attendants, and strengthen our referral systems to reach the marginalized communities in the city and in NCD. This effort cannot succeed in isolation. Eliminating maternal and neonatal tetanus demands a united front across not only NCD, but the entire country. It requires us to align our priorities, strengthen our supply chains, train and build capacity for our workforce, and engage with our communities.
The World Health Organization is fully committed to ensuring that all mothers with their children are safe from tetanus disease, with a goal to assist this routine immunization campaign throughout the country.
Since 1989, WHO, UNICEF, and other partners worked tirelessly to lower the neonatal tetanus 1 per 1,000 live births in every district. However, the administrative coverage of TD vaccination in Papua New Guinea remains very low. It's around 30 to 45% in the past 10 years. That makes it difficult, and that makes it every district in PNG to face significant challenge to eliminate maternal and neonatal tetanus. Our goal and our mission is clear. It is to eliminate maternal and neonatal tetanus. So the campaign also includes the distribution of iron folic acids, which is very crucial to prevent anemia in pregnant women. And also it integrates routine immunization for children and also distribution of mama books for pregnant women, and includes also neonatal tetanus surveillance and health promotion. This is a comprehensive and holistic approach to protect the health of mothers and children. However, in line with the global recommended strategy for maternal and neonatal tetanus elimination, immunization alone is not enough. We must also ensure full continuum of care through our maternal and child health programs within the framework of primary health care and universal health coverage. This means pregnant women should receive routine care along with the TD vaccination, ensuring protection of themselves and their newborns, which are safe delivery practices, including skilled birth attendants and hygienic conditions, are very critical to protect them from neonatal tetanus. Equally important is encouraging our local communities so that they understood and practice preventive practices to prevent mothers and children from neonatal tetanus. This comprehensive approach, including integration of routine immunization, iron folic acid supplementation, and clean and safe delivery, is the way to build a robust health system that will truly eliminate maternal and neonatal tetanus. So our efforts are already making progress. We are supporting, WHO is supporting together with UNICEF in this campaign, and we are integrating routine immunization. 6 of the 7 provinces are receiving funds for periodic intensification of routine immunization. This initiative is very critical to reach all children eligible and protect them from vaccine-preventable disease.
This campaign drive will be facilitated over the next 5 years with 3 routine vaccinations for women and girls from the ages 15 to 44. The campaign will be done in 2 phases, with the first phase of the campaign that will be conducted in NCD, Central, Milne Bay, West New Britain, Southern Highlands, East Sepik and Manus provinces, while the rest of the other provinces will be covered in the second phase. Dr. Satish Gupta, the Chief of Health at UNICEF PNG, hoped by 2027, PNG will have eliminated maternal and neonatal tetanus in the country.
Maternal neonatal tetanus is one of the disease actually, which is, and presented also by Philomena, is very largely fatal. That means if a child or anyone gets infected with the tetanus, the treatment or the cure rate is very low. And most of the children who suffer from tetanus, they ultimately will die because there is no treatment to it. Only very few children could survive this tetanus. So that's why this is very important that we embark on this journey to eliminate tetanus from the country. And as I also mentioned that many of the countries in the world, they have eliminated using the same strategy, which we are now using it to do tetanus vaccination campaign for girls and women between 15 to 44 years of age, along with improved maternal and neonatal services like improved antenatal care, improved service safe delivery, improved cord care practice, newborn care practices, and also strengthening the surveillance system so that we don't miss out any tetanus case. Because if we know where the tetanus cases are happening, we can also find out where we need to make more efforts to eliminate this disease, which is a very deadly disease. As is also mentioned that PNG, since our coverage for tetanus in the routine immunization remains low, especially for the girls and women between that 15 to 45 years of age, this provides an additional opportunity to get this TD vaccination done so that this tetanus could be eliminated from the country over a period of time. And as the target said, 2027, by the time we hope that all country will be able to improve the vaccination coverage for tetanus, but also for other maternal and neonatal services, so that by 2027, PNG is one of the, again, country where they have eliminated tetanus from the country.
The vaccine used in this campaign is the same safe and effective tetanus vaccine that is already included in PNG's National Routine Immunization Program, commonly administered during pregnancy and childbirth. While this campaign is an important milestone and positive step in the health sector, PHAs are urged to make this campaign a priority.
PNG is one of the 10 countries in the world and the only one in the Pacific to eliminate maternal and neonatal tetanus. This launch marks an important milestone in our national journey to protect the health of the well-being of women and newborns across Papua New Guinea. Not only that, but this launch marks a positive step PNG is taking to reach the elimination status of neonatal tetanus in PNG at the end of this campaign in 2027. Starting this June, we will commence this life-saving campaign in our communities to ensure that no girl or woman and newborn dies from a preventable disease like tetanus. This is a very important campaign because tetanus may be a silent killer, but it is completely preventable through simple and cost-effective interventions. Through this campaign, we are focusing on vaccinating all the girls and women aged 15 to 44 years with the tetanus diphtheria vaccine, promoting routine immunization, clean and safe deliveries, and raising community awareness on maternal and neonatal health. This is not just a public health campaign, it is a commitment to equity, dignity, and human rights. Every woman, regardless of where she lives, deserves access to the protection this vaccine provides.
This launch is a collective call to action. The determination to end preventable deaths caused by tetanus. With the knowledge and tools we already possess, Dr. Fiona Coupe, a pediatrician who has witnessed the deadly toll of tetanus on newborns, stated the safest option is prevention.
Overall, immunization, the immunization program and vaccination is a cost-effective strategy, cost-effective public health strategy, meaning you can save a lot of money if you put all your money into immunization drives, getting the vaccination to where it's supposed to be. It's more cost-effective than if you have to treat the child or the adult or the mother who comes in with the disease. So just encouraging us in that space as well. So for overall, what can we do? It's a teamwork. It's always a teamwork, team effort, working together. So within our communities, in our communities, we already have the systems there. You have the community leaders, you have the youth groups there, you have the mama groups, you even have schools within communities. And guess what? Within those communities, there's also health facility within that community, but we're not linking up. So one of the messages and advocacy that I'd like to raise here, in your conversations, let's strengthen that community level. The community leaders, get them to link with the health facilities that are within their communities, and then come up with plans on how they can improve, outreach. And that's the key factor. With immunization, outreach is not happening. And we've seen when we've had SIAs like now we're going to have the one with polio as well. When we have outreach, our immunization coverage numbers, it spikes, it goes up. That tells us to invest in outreach programs as well. So within provinces, provincial governments, we need your support, your members, the district members, with the provincial health authorities, with provincial partners as well, working together with our communities to improve this immunization and vaccination coverage. At national level as well, policy guidelines, as always, and advocacy, higher advocacy to governments for maintaining and sustaining vaccine financing and the logistics around that as well. Tetanus is a deadly disease. It affects all ages, and we're really, particularly for the newborns and the moms, there is no cure. Even if you survive from tetanus, you are not protected. You have to get that tetanus vaccination. So bunny suit with tetanus vaccination, or sometimes now you'll hear TD vaccination, will protect you. So I appeal and encourage families, local communities, provincial governments, organizations, business houses, and all girls and women within the our target 15 years to 44 years to get the tetanus vaccination and protect ourselves. And let's all work together to reach and achieve tetanus elimination status. Thank you.
Papua New Guinea is one of only 10 countries in the world and the only country in the Pacific yet to eliminate maternal and neonatal tetanus. With statistics, the tetanus vaccination rate in PNG has been low for the past 10 years, averaging just 30%. With 80% of the population living in rural areas, access to quality antenatal services and clean supervised birth deliveries remains a challenge. However, with this campaign, PNG is looking at eliminating tetanus in the near future.